Hi, I'm David King-Lassman. This is another episode of ExploreXR. Today, I'm absolutely delighted to be joined by Caitlin Yeager, affectionately known as Kate. Kate, welcome. Nice to have you.
Thank you for having me.
So you are an assistant professor at Ursuline College. First of all, tell me about the college and tell me a little bit about what you do there.
Yeah, so I work for Ursuline College, specifically in the Breen School of Nursing and Health Professions. We were specifically for nursing up until about 2 years ago when we added in our physician assistant program, so kind of growing some more of the health professions here at the college. We're a small liberal arts college, under 1,000 students, but the nursing program makes up close to 400 of those students, so a good majority of the college. And we're located in a suburb just outside of Cleveland, Ohio in the States. And I am the director of our Health Resource and Simulation Center, so I help coordinate all of our lab spaces, as well as all of our simulation and a lot of our educational technologies here at the college.
Great. So let's just get straight into this. After the pandemic, I think it's fair to say that the health sector suffered, a real crisis as the industry was faced with burnout. People were leaving in droves. How did it manifest for you in your college? What were some of the issues that you were seeing, and how did you respond to that in terms of providing resources to help address these issues?
Right. Yeah, a lot of schools, and we were not immune to this too, we're really struggling for clinical experiences. How do we get our students to be able to translate what they're learning in a classroom environment, which some of that was online, to a clinical environment, which was mainly shut down to students at the time. And so figuring out ways to really incorporate different modalities of simulation, not necessarily our standard use of mannequins because we couldn't come all together in one space, but different ways to adjust some of our teaching strategies so that students were not missing that connection between that didactic component, what they're really learning, and how do we apply that to specific situations within the clinical environment. And so a lot of that, because of that, I think shifted a lot of nursing education specifically, but all of healthcare education to those online, more of the virtual reality, augmented, extended, mixed, all of the gamut, but really forced us to start using the technologies that were available, that have been, emerging really over the last decade or so.
Right. So, and if we take a step back a little bit, getting students onto campus and in sim centers was incredibly important. It played a vital role in preparing students for clinical practice. Can you describe some of the simulation techniques that you were using and relying on before we went more digital?
Yeah, so we have used simulation in a lot of different venues, everything from your static mannequin task trainer, kind of here's the model, here's the IV pad and insert the IV, to our high fidelity mannequins that really are true, as close as we can get to the patient, and designing scenarios with students around that, as well as some use of standardized patients. Now, our college doesn't rely as heavily on standardized patients as others, but we have used them especially for more of the learning for clinical skills related to therapeutic communication, especially within mental health, and those kind of environments. And so we really relied very heavily on our high fidelity, probably the most as the modality to use for students, because it's as lifelike as we can get it. We can design specific scenarios for the learner where they're at in the curriculum, because the scenarios that we use and the objectives we need to meet with our early entry learners, that first semester nursing student, are very different than what you're using in that last semester as they're ready to transition to practice. They have a lot of different needs at that point, and they have a lot more knowledge. So getting a little bit more involved in that, but definitely have highly relied on the high fidelity components of simulation truly up until this point.
Right. And they are amazing. For the benefit of those people that haven't seen them, you know, these mannequins can bleed and their eyes can blink and their hearts can beat. Um, they'll continue to play a vital role in the way we prepare our medical professionals for practice. But can you point to some of the limitations or challenges that you find with that modality of training?
Of course. Yeah, I think that the biggest challenge, especially for us at a smaller school, is the availability of faculty to facilitate those scenarios. You really, in order to get a great experience with students, can really only put 3 or 4 students in one of those scenarios at a time. And most of our scenarios take, 20, 30 minutes at least to get through. So if you've got a class full of, most of our classes around here are 25 to 30 students in small groups of 3, that's going to take an entire day, of which we don't always have. We don't have the time or the space to do that with the mannequins. And the other challenge that we face too in our state is we are not able to substitute simulation for clinical time, which some people would say that's a really good thing, right? You want your students in the hospital setting as much as possible, but there's so much great learning that happens within simulation environments. And it's really difficult to be able to shift time for students to get through that. So that's kind of one of the biggest limitations with the high fidelity or the scenario based is that time component and resource allocation to that.
So Kate, I read something that you said. Simulation in nursing goes beyond simply training manual tasks. Clinical judgment is vital to success in both training and practice. Clinical judgment, what is that, and how do you train for it?
It's a great question. And it's one that is, I feel like clinical judgment is a term that has been emerging, kind of similar to critical thinking that was really popular even 20, 30 years ago, but really starting to get into how do healthcare providers, and again, I'm a nurse by background, so I default to nursing. How do we get nurses to be able to recognize what is going on with a patient, analyze what's going on with them, make some decisions, and take action with that patient? And in essence, clinical judgment, there is a clinical judgment model. It is based on the work by Tanner and her colleagues, but also the National Council of State Boards of Nursing, or NCLEX, or NCSBN, who develops the NCLEX exam, have really kind of pushed that a little bit more with utilizing clinical judgment to develop some of the board exam questions. And in a sense, really what it is if you look at an expert practitioner, whether it's a nurse, physician, nurse practitioner, anybody that's in healthcare, they are so equipped and trained over the years with their knowledge base and their experience level to look at a situation, analyze very quickly what is going on, decide what they need to do it, and then see, did that help the patient? And so the clinical judgment model has 6 steps, and that's essentially what it's doing. But when we're training new healthcare providers, they don't necessarily have that experience to be able to say, that's exactly what's going on with that patient, and this is how I need to react. So we need to train them for that. So utilizing simulation and different aspects and modalities within simulation, especially when you're looking at preparing learners within the pre-brief and the debrief, and exploring in the debrief, you can really get at each one of those clinical judgment steps of, let's recognize what is going on with this patient and make those decisions and make those connections.
So clinical judgment can be something like a visual cue, or it could be a verbal exchange. Is that right?
Definitely. It could be even just looking at vital signs and saying, these are the vital signs that are abnormal. The heart rate is abnormal, right? And taken together with the fact that the heart rate is abnormal, and now I'm listening to the patient and I see that there's maybe an extra heartbeat, or there's something abnormal within that rhythm. Okay, now what does that mean? So yes, exactly. It can be visual cues. It can be something that the patient says. It can be something that we're picking up on the assessment. All of those components.
Right. I'm getting ahead of myself a little bit, but I'm guessing that technologies like ours, in fact, the full roster of great applications that are out there, both in VR and MR, are going to be incredibly useful in helping to drive those clinical judgment skills.
Very much so, because especially with the use of something like Hollow Patient, we've been able to say, okay, let's take a look at what's going on with the patient. What are you seeing in your assessment? What are you seeing in those vital signs? Let's put that together. What might that mean right now? Let's make maybe a guesstimate or a judgment. What do we think is going on with this patient? Now, because of that, what else do we need to explore? What else do we need to find out?
Okay. So you referenced Hollow Patient. I think full disclosure here, we have to share the fact that you are a long-term user of the GigXR platform. Can you talk about what initially attracted you to this mixed reality platform?
Yeah, I will say that I kind of came in after we had started to implement it as a faculty member, but our dean was extremely excited about the opportunity to really utilize educational technologies to drive some of that active learning really within that classroom environment. Because as we talked about previously, with the limitations of simulation, is that you can't always get all of the students in at the same time. There's time limitations, space, resources. But with this kind of modality, it's something that we can utilize in the classroom environment. We can use it as an active learning strategy. Every student can be involved at the same time. So that the nice thing is it doesn't take as many physical resources as a simulation lab might. And so that definitely drew us to the idea. But again, it's that ability for students to really start making connections between the content and the clinical environment. And that's something that's really difficult to do with just maybe a written case study. So, okay, you have this patient and this is what you're seeing and you're talking through it, but until they actually see that in the patient, it's hard for them to make those connections. And so the application really has brought to life that ability of students to make those connections. And I think that's really, why we have gravitated to that and why we continue to use the product and why we continue to evolve how we use it as well.
So let's talk about that then. You just said how we continue to evolve using the product. We as a software vendor, we give you a piece of technology. We make an assumption when we build it, it's going to be used in a particular way. So if we look at something like Hollow Patient, it presents a standardized patient exhibiting a certain pathology. Mm-hmm. How can you take something that on the face of it seems so absolute and evolve it to deliver additional value?
Yeah, there's a couple of ways. So one of the ways that we started was by, again, I describe this to first-time users, to our students that are new to the application. I say, this is an unfolding case study with video or with visual, right? So they kind of understand what it is. We give a report on the patient. We talk through a couple of things. They see the patient, they're assessing them. One of the things that we did first was kind of augment it a little bit by incorporating some extra content or some values. So for example, we use Millie Taylor, who's has diagnosis of preeclampsia, and she has a lot of lab values and other testing, things that are going on within that scenario that was in the facilitator guide. Well, instead of just reading out what those lab values are, or what tests we might want to do, we created a PowerPoint deck to go with that scenario, that when we're saying to students, okay, well, what labs do you think that we need to get on this patient? And they're throwing things out, right? We're like, okay, great. We just got those. Here's your results. Let's now interpret those results. So it's kind of being used in conjunction with the scenario. Another thing we've been doing a little bit more often is we had a need to really prepare our students for prioritization and delegation, something that they really have to be able to do well as new nurses. But a lot of our employers were saying, students really are lacking in these skills. It's really hard for them to prioritize patients, prioritize their orders, and delegate to other types of healthcare providers and personnel. And so one of the things we did was we started using multiple patients within Hollow Patient and creating almost like a multi-patient simulation with them. So we had 3 patients that we drew out. So 3 different diagnoses. Students got a little mini report, got to see each one of those in succession, and then took down some notes as to what they were observing. And then they worked in groups and figured out who is the highest priority patient. So we've been able to kind of combine some of the patients. And then lastly, I'm actually working right now on developing a mass casualty simulation using all the patients. But again, they're not going to be used as their actual pathologies because I need some of them with wounds, some of them that might have breathing issues, some of them, with different conditions. And so because it's so difficult to create a mass casualty or a disaster simulation, it's a lot of labor intensive, a lot of resources and people. I'm like, well, why can't we just use the same concept and pick 5 patients from the Hollow Patient genre and adapt their story to fit within a disaster? So those are kind of ways that we're utilizing and taking it kind of off script or augmenting some of the facilitator guide components that are already built in.
Yeah, I mean, that's exciting to hear. And so I can extrapolate from that then that you're using the same content to teach across multiple levels, right? Not just for your first entry intake and so on.
Definitely. Actually, it was kind of funny because we've used one of the patients that's in the prioritization scenario that is used in the junior level. They've already met that patient at the sophomore level, and several students said, "Oh, hey, we've seen Susan before. We've met her." So it's almost like a familiarity the students really enjoy. But we've used them in different contexts. So in the sophomore level, Susan Ferguson, she has a burn. We learn about basics of wound assessment, pain assessment, pain management, wound care, wound healing. We spend a lot of time really drawing out that pathophysiology and that basic care in the sophomore level because that's their first semester. Then in the junior level, we've used her again, but in a prioritization. So she's now in the emergency department along with 3 other patients, and she's got a burn. So now what do we need to consider as far as her risk factors? Do we need to see her first or not? And you could probably even take it a step further with, with another level, or like I said, I'm considering using her for our mass casualty component as well. But yeah, there's ways to adapt to the different levels, just in how much you want to get into that pathology or how much you want to hold back. Actually, just even today, I was working with, again, a set of sophomore students in our accelerated nursing program. And there was a lot of discussion about pain management with Doreen Siegel, who's got a hip fracture. And they're not at the level, they have not had pharmacology, so they don't understand medication management yet. But we were still able to use her and really talk through what are those non-pharmacologic things? How do we assess her pain? Those kind of components. And then we could use her again in med-surg 2 and pharmacology and really maybe work through the pain management component with medications. So ways that you can adapt to different levels of learners.
So, Kate, people that listen to this podcast will know that I'm incredibly passionate about mixed reality. How do you feel this type of learning has benefited by being in a mixed reality environment compared to, say, a full virtual reality?
Yeah, I think what's nice is that one of the things about virtual reality that is really fun is that it's very immersive as far as that one learner is in that entire environment, right? I think about things where maybe you're walking straight into that patient's room and you're grabbing things off the wall and doing that. And that's really great. But it's also a very individual experience for that learner. What we're able to do with more of that mixed reality and that's this extended reality is it's more of a group learning. There's still the ability to break that apart and have individuals interact separately and in their own capacity, but it's really a shared experience, which is similar to a shared experience that you might have within like a high fidelity scenario, right? All of the students are seeing that exact same patient. They're seeing things together. They're working through problems together, which is why I love using this in classrooms, is because you can either do it as a full group, depending on your classroom size. Like today, our class was only 12 students, so we're all doing this together, or splitting them up into small groups. And I think that that's kind of the exciting thing about using this technology versus a true immersive, fully immersive environment, is that collaborative nature of that learning experience.
So I know that a lot of institutions that want to introduce innovative technologies, and particularly through unfamiliar media like virtual reality or mixed reality, it's often quite challenging when you have to get buy-in across faculty. People will say, I'm not putting my head in a headset. Did you find that you had challenges in convincing people that there was merit in this medium? And if you did, how did you address them?
Yeah, I will start by saying I don't believe that we had any faculty that were just completely against the idea. They all saw the value in what this technology could bring to them and to their classroom, especially as we started saying, look, this is the ways that you can use and adapt. But you're very right. There are a lot of faculty that were just like, I'm willing to do this, but I don't want to wear the headset. I don't want to learn how to do it. So what we have actually done is, well, first, I found the faculty that were the great early adopters that were like, yes, I want to learn this. Let's get into it, train them up, and they're using it. And they're now finding different ways to utilize some of the patients in their own courses. The other faculty, though, that have not, I've gotten them to at least embrace the idea, like I said, of using this. And they really, once they see it used with their students and how much their students are getting into the scenario and how much they're learning from it, they very much appreciate the technology. But the ones that are still maybe a little bit hesitant to put on the headset or anything like that, I have actually just will go to their classroom. I sit in the back, I launch everything, and then they're doing all the rest of it. So there's a lot of ways that you can kind of work through that. And again, it's a technology that sometimes it's just you need to keep playing with it. You need to keep immersing yourself in it. I know for myself, just practicing using it was very easy. But one of the things that also has really helped was, because of the pandemic kind of accelerating the timetable for the mobile app, that has really helped as well. We're able to get even more students into and using that technology, seeing everything that's going on at the same time. So that's kind of one of the other perks that we've had, and abilities for really easy, seamless, quick use in the classroom.
So we have authored with you a case study of how you guys are using this technology. You've been doing some research. Can you talk about some of your findings? One I was particularly interested in was helping students think like a nurse, which is, it seems so obvious, and yet it must be quite a challenging thing to achieve. Because if you don't think like a nurse and you go into clinical practice, I'm guessing that mistakes might get made or your confidence level might be low and so on. So can we talk a little bit about that research and focusing particularly on that?
Yeah. So the ways that, so again, a lot of research so far, and our own as well, has been a lot of, how do students embrace the technology? How do they like it? Do they feel like it's helping them? And one of the things that we wanted to know was, again, when we were putting we call it our prioritization scenarios, we now have two. We created one originally with 3 patients, and have now put that in the junior level. And we created a second one for our leadership course. It's a little bit more extensive, and are using that in the senior level. And we wanted to know, does the use of this prioritization simulation, which again uses the hollow patients, does it actually increase their ability to prioritize? So if they're given a set of patients before. So what we did is we set up a pre and post study in a sense with our senior level students. And I gave them a list of 3 patients to prioritize before we did the scenario. And we looked at the percentage of students who actually got it correct. Then we did the scenario and the learning exercise with students. And then afterwards, I actually gave them the same 3 patients to prioritize again, not having given them the answers, and wanted to know how many of them could get it right that second time. And we did see an increase in the students who were able then to correctly prioritize the patients in the post test. There's also we used what is called the set M. It's one of the really well-known simulation evaluation tools as far as how students are perceiving their simulation experience. And 2 of the questions actually will, they relate to the pre-brief or to the confidence level. And so students were asked basically, how did this scenario or how did this exercise, do you feel like it increased your confidence and the ability to prioritize a list of patients, which we did find that students, just from this one exercise, their confidence increased by about 18%. And their confidence in prioritizing a set of provider orders, so not just who of the patients are you going to see first, second, and third, but of those, if we gave you a set of orders that you now have to prioritize what you're going to be doing first with this patient, second, third, that also increased. And their ability to then take that and figure out, how can I delegate these tasks, also increased by almost 20%. So a lot of it, again, was based on student perceptions, but that's really great to be able to see that students are really feeling more confident in those abilities because, again, like you said, thinking like a nurse, you have to, right out of the gate, be able to see your patient assignment for the day and say, I have these 3 patients, or I have these 6 patients in some sense. Who is most critical? Who is the highest priority? Who is going to be the person I absolutely have to see first? And so this exercise in utilizing this technology really did help our students gain confidence in those skills, as well as be able to truly do the skill itself. So that was something that we've done and continue to kind of look at how that's impacting student knowledge and skill.
Yeah, and maybe this is an unfair question, but of those outcomes, which do you think is the most vital, important, or one that you're most pleased about in terms of the trend that you're seeing in terms of it driving good outcomes?
Yeah, I think that again, as we're now structuring this across different levels of education, because when we did this study, it was really just that one-time experience that students had with that prioritization. We're starting to see is that if we're introducing these concepts even earlier, students are starting to say that they, again, when they have this ability again to do a similar exercise, they're feeling even more confident in that. And they're being able to take those skills directly to the clinical unit when they're working, especially in that senior level in their practicum, working one-on-one with a nurse, taking a full patient load, doing all of those and having that responsibility. They're really being able to make those connections and to do that. So we're hoping to do further research on those gains over time and to see and really be able to quantify what our students are telling us that they're being able to do.
Yeah. And I love hearing this because it sounds like you are involved. You are evolving as educators. You're using a modality of simulation and adapting its usage as you use it, right? Because you're constantly thinking, how can we
Yeah.
refine it? How can we improve it, and so on, which is great. And it's good to know that platforms like ours have that kind of flexibility and extensibility. So forward thinking now, looking into the future. First of all, let's think about how you think that this system in particular will continue to evolve and where you think it might lead to additional outcomes. But also in general, where do you think nursing education is going to be in terms of the way it adapts to embrace these types of technologies? And what are you going to want to see from the developers out there who are building these solutions for you?
Yeah, it's a great question. I will say that in a lot of conferences that I've been going to over the last year, the use and integration of AI into a lot of the different types of platforms that are already available, or the technologies that are available, have definitely been increasing, and the use of AI in healthcare itself for different types of patient communication, diagnoses, these kinds of things. We're seeing more and more AI at the bedside. And as we see more and more AI at the bedside, and how healthcare providers and nurses are utilizing that technology in the care of their patients, educators are going to have to really start integrating more of that technology into our educational modalities as well. And so thinking about that integration, there's so many, great educational technologies, and I think adding that layer of AI into them, especially when we're looking at generations that may have more difficulty communicating with others and face to face with others, the use of things that are AI driven to assist maybe with communication skills, interviewing skills. We're looking at ways of, instead of using a standardized patient to come in and have you do a health history on them and maybe get graded on how you're interacting with that person, that standardized patient, can we use AI to do that instead? And again, that is utilizing, different types of resources. It might help reduce the cost of using actors, standardized patients. But again, it's getting students to be starting to utilize that technology in a way that they're going to see technology be used in their clinical environment. And I think that that integration of whatever we're doing in the healthcare field and that sphere needs to transfer over to education and have opportunities for students to practice with that before they're in the clinical environment as well.
Fantastic. I think a lot of that vision is, I'm not even going to say it's around the corner. I think a lot of it's already here, and it's certainly going to transform, I think, the way that we train and we experience healthcare. It's been a real pleasure talking with you. Thank you. Obviously, thank you for being so enthusiastic about the GigXR platform, and now being vocal about how you're using it. And I encourage people to look at the case study and learn from your learnings. I have said this before, but I think that nursing is the heart and soul of the medical profession. And you're doing a phenomenal service by helping to put better nurses out there. So thank you for that. Any closing thoughts from you, Kate?
No, thank you so much for the opportunity to share a little bit of what we're doing, especially within nursing education. And like you said, it's anything that we can do to help our students to be better and transition into great nursing caregivers will be great. So thank you for the opportunity to share what we've been doing within our educational realm.
Fantastic. Well, thank you so much again. I'm David King-Lassman. You've been listening or watching to Explore XR.